Hi, I'm Bonnie Jackson, and I'm a volunteer with ARP Arizona's Community Education Program. And today we're going to be taking a look at Medicare Open Enrollment and Medicare Advantage. It's hard to believe, but once again, it is time for Medicare Open Enrollment. We have some good news, though, on Medicare coming up. The insulin copayment has been capped at $35 a month, and the Part D donut hole is now gone. And so prescription drug costs in the catastrophic stage will be 0% starting in 2024. Medicare will now be able to negotiate prescription drug prices, and we're anticipating that prices will go down as a result of that. When it comes to open enrollment, it's the same time every year, and it's going to start October 15th and run through December 7th. I encourage you to check your mail for important notices from Medicare or Social Security regarding these changes in coverage, costs, and service area. Also, if you haven't already received, you will be very shortly, your Medicare and You handbook. And just inside the front cover, it will tell you of what's changed or what's new. If you're happy with your current plan, then you don't have to take any action. But if you're thinking that you want to explore some other options, or if you're new to Medicare, then this would be the time to do it. Also, if you need personalized help within your community, you can be able to find free information and events that are going on from either Medicare counselors in your area, or you can call and have a phone conversation, or set up a person-to-person interview. And you can do that through their state health insurance assistance program, which is run by the Area Agency of Aging. Our objective today is to provide basic information on Medicare Advantage. We're going to be discussing the three parts: hospitalization, which is Part A, your medical care and durable equipment, which is Part B, and your prescription drugs, Part D. Keep in mind that there are two options in Medicare. You can go with Medicare Original or the Medicare Advantage plan. And I want you to keep two things in mind as I go over this, because you need to be aware of what your current health needs are. And ask yourself, are you relatively healthy, or do you have chronic illnesses that might require regular visits to the doctor or perhaps even hospitalizations? And the second question is, what is your current financial situation? Because those are the two main things that will determine which plan you want, Original or Medicare Advantage. So let's start with the coverage for hospitalization, or Part A. This is for inpatient care if you are admitted. Sometimes we end up going to the emergency room to have something checked out, and they may just treat you and send you home. In that case, your Part A would not cover it. But if you are admitted and spend even one night in the hospital, then your Part A coverage kicks in. But you need to be going to a doctor or a hospital within your network, and they have a health managed organization. They also offer PPO plans, which expands the network a little bit for you. They do cost a little more. If you already have a current doctor and you want to make sure you can keep them, you could check into a PPO. And if you do have an episode in the hospital and then you are released, you might require skilled nursing after that, stay in the hospital. So that would also be covered. And then hospice for end of life care. It's not covered by Medicare Advantage plans, but because it is covered by Medicare in general, they would take care of it. And of course, if you have home health care, perhaps after a surgery or something, and they want to come and do some in-home rehab, something like that, it would be covered. As far as a premium, no, there is no premium, because remember, you worked and paid into FICA for all the time that you worked, and that will take care of the premium for Part A. There is no deductible with an Advantage plan, but yes, there is a copayment. And if you had a hospital stay, it is based on how much money your policy is going to pay and for how many days per episode. So you need to read over each policy and make sure you have one that fits your financial situation as well as your health situation. And no, there is no need for coinsurance with Medicare Advantage. Now, your Medicare Part B is going to cover your doctor visits and any medical equipment that you might need. Once again, you need to be going to doctors and specialists within your network. If you have an HMO plan, you will need to have a primary physician and you would have to have a referral to go to a specialist. If you choose a PPO plan, you won't need that referral. You can just make your appointments on your own. But it would also cover outpatient care, the durable medical equipment such as wheelchairs or walkers, etc., and preventative services like yearly mammograms or perhaps colonoscopies. They may also offer you like discount gym memberships to maintain your health. And some plans now will cover dental, vision, and hearing, but you need to read over the policy and see because that's not guaranteed in all of them. The premium is just generally people have it taken out of their Social Security and it automatically covers Part B. And some plans, because these are means tested, if you have a pretty healthy retirement income, some plans will have an additional premium added on top. There is no deductible with the Medicare Advantage, but there is a copayment. So usually it's considerably less than 20%. And I know that if you've gone to doctors before, there's usually a small copay that you have to make. Sometimes like $15, $20, whatever. You will know that depending on your policy. And there is no coinsurance. On Part D, the coverage is going to include, unless you purchase a plan without Part D, which is available, but it would be included in your major plan in most of them. The premium, there is no premium, but once again, it's means tested. So if you have a pretty strong income for retirement, they may add a premium for your drug coverage. Some have a deductible, but most of them do not. So once again, you have to read your policy to be sure. And as far as a copayment, yes, and it depends on the drug tier. Every insurer has a formulary where they include the drugs that will be covered, and then they place them on a tier from 1 to 4. The 4 being the highest, most expensive drugs. So if you have a maintenance drug that you know is a pretty expensive drug, you're going to want to make sure you have a policy that covers it and see what tier it is on. And every year those change. Sometimes a generic comes out and it can lower the drug to a tier 1 or 2, which could save money. So you do want to check that out carefully. And in general, the coinsurance is going to be 25% of the cost that the insurance company is going to pay for your prescription drug. Now, there are many resources that can help you make these decisions because you will need to live with them for a full year. So you want to be very careful. The first is the State Health Insurance Assistance Program, or SHIP. You can go to their website at www.shiphelp.org. Just enter the state name, or you could call 800-432-4040. Another great resource is the Area Agencies on Aging, Region 1. You can call 602-280-1059 or go to Medicare at medicare.gov or call them at 800-633-4227. And for Medicaid assistance, our state access program, you can go to healthearizonaplus.gov or call 1-855-432-7587. You can also go to ARP at www.arp.org/Medicare QA, or you can call 866-687-2277. Thank you so much for joining me today on this very important topic, and we hope to see you again as we continue our series on Medicare and you.